to do that.
Start recording now, and we can.
That's it. That's it.
So you have the
Right
deck
there.
that we're using. We didn't get one
Yeah.
slides, so it's like,
In that, yeah.
did they email us?
I did not see it.
3 minutes.
Good. How are you doing?
Just two shall pass. That's my mantra.
Hi, I'm Jen.
Everything, so the PowerPoint's on here, it's not on Chrome, so that you don't get confused.
Now, do I have to launch the PowerPoint?
So whenever anybody is ready,
Do we have a light on Jack or
so hit start
Yeah,
webinar.
it's just,
Give it like.
that's what it looks like. It doesn't look too dark though when you. Yeah, so this, the slides are in this. They're pulled up, and then to advance them, Rich.
Yeah.
Here we go.
So, and we're starting with Rachel and then.
Then Q&A.
Then Q&A.
Then Q&A. Then power on
Okay, yeah, I think I prepare my own sort of remarks of yours, just kind of things to.
all good.
All right, guys. We got that 3 minutes. 3 minutes. We're going to be starting.
Dr. Ron. Nice to meet you, Carol. My
It's 9:28.
I've got it pulled up on my phone.
So actually what I would suggest is not sharing the screen. Out it, doing your introduction, out sharing the screen.
I don't think so.
Okay, just Jack.
Start something.
Goodbye.
And then when Rachel is ready to present, then I would.
And I'll share some.
Richard is talking.
I just walked through. Go around. I'm just
Yeah, so we're gonna go this.
No, it's Rachel, Richard.
Oh, yeah, because there's.
some of my comment.
Rachel doesn't have slides.
I know what
Where's
you're.
Rachel?
Rachel is just introduced.
Wait, Rachel.
Yeah, so Rachel.
During the
could talk a
webinar,
little bit about-
so
Maybe, so what I would suggest
microphone
is
picks up
Jack
the whole
talks without
room.
sharing a screen,
So we
Rachel
have to
talks
kind of
about
be
sharing without
quiet or
sharing a
else it
screen.
ships things.
Richard is ready to present, then you share the screen, we'll go to the presentation, and then it just stays up there until.
And phones off, everybody, or on silent?
So, okay, so right now,
Downstairs.
we're on this. So when we're ready, we've got 1
minute, guys.
And, okay, so that's on, okay, so he's gonna talk, and then when he's done, he's gonna choose Rachel. But we kind of want the, right now, to have the holding screen, I guess, you know what, it's fine.
You can
That's
do
fine.
it, it's okay.
You know what, that's fine. And then,
Right here, the camera's way back there.
yeah, I know.
I have it. Okay.
Yeah.
All
All right, 9:30, guys.
Yeah.
Are we all
And
ready?
then we're only gonna share screen once.
Ready?
can do
Richard comes on.
Okay.
Okay,
So
so.
let, you guys are on the screen, so
All
let
right.
people see Jack.
Jack in this.
You hit
Okay,
share
right at the
screen
bottom.
here, it'll prompt you to go here, and then you just hit slideshow.
Okay.
Okay? Want me to hit start webinar?
All right, here we go. We should see everyone populate.
Of course, they could hear me now, right?
Recording in progress.
Jack, move a little this way. I think he's, yeah.
So good morning, everybody. We're waiting for some more people to pop in, so just give us a couple of seconds. Let me know when to go. Are we doing? Mhm. Right. Okay, we'll just give it another 10 seconds or so. Let me know when to go. Oh. Okay, welcome everybody. Welcome to the Lancet Pollution and Health, a progress update briefing. Thank you all for joining us today. My name is Jack Caravanos. I'm clinical professor here at NYU School of Global Public Health, and I welcome you. Public health education at NYU has a long history, but most notably in 2015, we created a School of Global Public Health. The school has 56 faculty, 7 different departments, epidemiology, environmental health, et cetera. And we have many online certificate programs as well as degree programs. But today I'm very pleased to welcome you to our presentation of the findings and recommendations of the Pollution Update report that was published just yesterday in the Lancet Planetary Health Journal. The session today is going to be divided into 2 parts. In the first part, we'll go over the history of these reports. This is the second report, as well as some of the findings. For this, we have many authors in this report, but most notably, Richard Fuller, CEO of Pure Earth and founder and board member of the Global Alliance on Health and Pollution, as well as Rachel Kupka, who's the executive director of the Global Alliance on Health and Pollution. After these 2 presentations, we'll have a Q&A. As usual, remember to put your questions and thoughts in the Q&A column of the webinar, not the chat box, please. We may miss that. And as always, the program is being recorded, and you'll get that link immediately afterwards. In the second part of the program, we'll take a deeper dive into the call for action. And we'll do this from the perspective of 3 sort of sectors, industries, the scientific research community, the industry corporate world sector, as well, and then the communications and advocacy community. And we'll hear about their roles in implementing the recommendations of these findings. All right, so let's begin. We'll start with Rachel Kupka. Rachel is the executive director of the Global Alliance for Health and Pollution, and who will give us sort of a historical background on what brought us to this second report. Rachel, well, here, it's all yours.
All right, thank you, Jack. It's really wonderful to be here. Thank you to NYU for hosting us today. So I think a lot of people here, of course, in the audience and online have or are familiar already with the 2017 Lancet Commission on Pollution and Health, but you may not be quite as familiar with why it was such an important and groundbreaking report. So there's a lot of firsts in this report from 2017. You know, first of all, it was the first time we looked at the impact of pollution and health globally. It was the first time we collated the data on the burden of disease and said, wow, this is an issue of public health concern. And it was the first time we were actually able to compare it to other public health, major public health issues. Another first, it was the first time we were able to see where the impact lay in terms of geographies, right? So the impact on low and middle income countries really came to the forefront. And we were able to see how much it's actually costing, what it was costing in terms of lost productivity and on people's health and on the inability to work if you're sick or obviously if you're dying. And it was really the opportunity for us to see what the impact is, not only on health, but economic development and the stymieing of generations to be able to attain and lead healthy and productive lives. And this is, what motivates the Global Alliance on Health and Pollution and many of our partners, right? Trying to protect children's health for the future. And it was a report that was one of the most successful that the Lancet had ever done. We had a huge outreach, thanks in large part to Pure Earth and Toga Run and many, many others. So where are we 5 years later? Well, Richard Fuller, the lead author of the report, is going to tell us all about that. But basically, you'll come away with thinking, gosh, it's been 5 years. What have we done? And so he'll tell you what we haven't done and what we have done. And then I'll come back in a little bit and give you some ideas about what we can actually do to solve this problem. So I'm really pleased to introduce Richard Fuller. He is the founder of the Global Alliance on Health and Pollution, the founder of Pure Earth, the president of Pure Earth and CEO. So over to you, Rich.
Yeah. All right, Richard, let's get you set up.
Thank you, Jack. Let's
No. Share screen.
Share screen. And then we're going
That one.
on the left.
That.
and
And
then play.
And then slideshow on the right. Yeah, that one.
Good.
Okay.
Thanks, Jack. And a delight to see everyone here, and especially thanks to Jack, who just got a wonderful award, I think, from Taylor Swift at NYU. Yes.
Not exactly, but yes.
It was just superb. And thanks to NYU, they really do wonderful, wonderful work. So how do I click? Is this is the clicker here? This one here. Okay, very good. So what I'd like to do now is to talk about the results of the update report that we just released in Lancet. And this was produced under the auspices of the Global Alliance on Health and Pollution, which is really kind of like an international organization representing different countries that are severely affected by pollution and its health impacts. So ministries of health and ministries of environment are there, as are all of the usual players in the international system. UN, World Bank, European Commission, and so on and so forth. It's trying to bring attention to this issue at scale, and it's really doing a wonderful job. And if one thing, I would heartily recommend that you all look to join this organization and follow and support it, because this is an issue we need to put more energy and attention to. So it is currently incorporated as an NGO in Geneva, and with lots of European support and some others from the US as well. The report itself, the Lancet paper, was gratefully supported by Sweden and Switzerland, and we give our thanks. So let me jump into the meat of our findings in this report. The first finding is that things are not getting any better. There's still 9 million deaths. 1 in 6 deaths in the world is caused by pollution. It's pretty much what it was last time. There are some trends that are really interesting. First, the West, wealthy countries, they've improved overall. We've seen pollution deaths reduce. Second, the traditional types of pollution, those that are associated with poverty, so that means sanitation and indoor air pollution, things that occur in the house when people are cooking with wood or dung and releasing smoke in their own houses. They have also improved globally, and that's wonderful. These two decreases in overall pollution deaths are offset, though, by a rather large rise in what we call modern pollution. And modern pollution are those aspects of pollution that are created because of economic growth, because of industrialization, because of more people coming into cities, for example. And so that's ambient air pollution, chemicals, and lead especially. And it's getting much, much worse, to the point that the overall number is staying much the same. As well as that, we also looked in detail at what the world had done since the first report came out. And we did this by looking at the development planning in low and middle income countries. Had they actually looked at this problem and decided to integrate it into their development strategies, and had the donor community, those who support international aid, also paid attention? The answer was no. There was a very, very small amount of attention to pollution. Usually, these positive things were specific to one particular city or related to one particular aspect of pollution. There was no broad support for the pollution agenda within the development agenda in general. Very little overseas development assistance at all. The third interesting thing we found was more and more, especially for chemicals, we're finding that pollution spreads across the world. It doesn't stay contained within boundaries. It's not just air pollution that moves across the boundaries, but a lot of chemicals are getting into foodstuffs, getting into the global food supply chain. So I will talk about each of these things in a little more detail. But really, the disappointing thing is modern pollution, it's getting worse. We're not doing much about it. And this is really something that is of enormous concern, given that pollution is, in fact, the largest thing that causes death on the planet. Let me dive into some of the details in all of this. These two charts, these two lines here, the orange line shows reductions in traditional pollution, those associated with poverty. Since 1990, you can see a really steady reduction in gross numbers of deaths. Offsetting that is that increase in modern pollution. By the way, overall, modern pollution deaths, 92% of them are in low and middle income countries. And just to show that, these two slides, the one on the left shows death rates broken down by each of the aspects of modern pollution for wealthy countries. And you can see the steady decline there, especially in ambient air deaths. So the West has done quite well in controlling and managing air quality over time. On the other side, of course, you can see how bad it's gotten in other countries. Now, drilling into each of these specific issues within the modern pollution agenda. Air pollution is the big one. Overall air pollution numbers, 6+ million deaths a year. The piece that's increasing, ambient air, is 4 million of those. It used to be that household was larger. Now, by far, modern pollution is larger in its impact. We also found that the levels that the data set we use, by the way, is from the Institute for Health Metrics and Evaluation, who are the global holders of all data related to public health. They're based in the University of Washington, Seattle, funded by the Gates Foundation, and they're used by every major institution around the world to provide health data, and they're our partner in this particular process. The level that they use to look at air pollution impact is actually higher than it should be. New studies have come out showing that air pollution lower than the standard that we currently have, which is, by the way, the WHO standard as well. We're seeing more cardiovascular disease at lower levels. So watch that space, because there's more that needs to happen. It's also very obvious that the link between ambient air pollution and climate is very, very clear. And the basis for this is that the majority of ambient air pollution, the particulates that cause these diseases and deaths, they are from fossil fuel burning, automobiles, power plants, and the like. And so reducing climate change will have a significant impact on ambient air and modern pollution. In fact, one study finds that an investment only on climate change, moving to renewables, has a better bang for the buck in terms of public health than an investment in reducing the levels of PM2.5. So you can save more lives by actually moving to renewables than you can by trying to reduce air pollution levels. The second big piece of modern pollution is the chemicals agenda. Let me show you the large orange one on the left is all of pollution at 9 million deaths. The chemicals agenda alone is 1.8 million of those 9 million deaths. And that's broken out on the right. There are two key components in the IHME database. Lead, which is responsible for the majority of the chemical deaths, 900,000 premature deaths a year. And the rest is occupational chemicals where people are contaminated and die prematurely from exposures in their workplaces. That's 870,000 deaths. So first, a few things to note. Lead at 900,000, that's bigger than HIV, which is 864,000. Much bigger than malaria at 643,000. Just to put it all in comparison, lead kills more people than HIV. Second thing to note, there's a lot of chemicals that are not included in this analysis because the standard that IHME uses is a very high threshold of scientific analysis in order for them to integrate pollution deaths or any kind of deaths into their data set. So in this analysis, there's no mercury, there's no PFAS, there's no asbestos, there's no pesticides deaths, there's no endocrine disruptors impacts, although they're mostly disability rather than death. They're not currently integrated because there isn't simply enough study to show what it means at a global level. So many experts think that if we were to properly estimate the overall chemical burden, it's more likely to be not 1.8 million deaths, but more likely 3 or 4 million deaths. So to put that in perspective, the chemical burden of disease is probably around the same size as the ambient air pollution burden of disease. Okay? Don't think that chemicals are just a small thing, not to worry about them. Here's lead killing almost 1 million people, and overall it's as big as air pollution, or will probably be in the near future. By the way, just to show how this agenda has just simply not been addressed adequately, in the SDGs, which you all know well, I'm sure, the only way that chemicals are currently measured is by measuring unintentional poisoning from pesticides, which is currently 11,000 premature deaths. Here it is at 1.8 million, yet the SDGs can't even get close to what it really is. Let me drill into lead, because that 900,000 really jumps out at me. It seems to be an extraordinary kind of problem. It certainly means a couple of things. First, it means that lead, by far, is the largest chemical of concern that we worry about in the world. In terms of its impact on public health, this one is probably 10 times larger than anything else. In fact, another piece of research that's included in this report was put out a few years earlier, found that 1 in 3 children in the world are currently lead poisoned. Their blood lead levels are above 5 micrograms per deciliter. 1 in 3. And most, again, in low and middle income countries. And this is not lead in gasoline. That's gone. Instead, it's lead from battery recycling, improper. It's lead from food additives. People are putting it in turmeric and things. It's in cookware. It's in paint. It's just a problem that deserves attention. And there is some response to it. We'll hear a few stories of good things going on in this, but it's only the starting point. I recommend you to that report, The Toxic Truth, to understand more about lead's impact. As well, it's lead mostly that we're seeing show up in contaminants that are exported globally. They're finding lead in whole foods, in different spices, in McCormick's spices. There was a very good report from Consumer Reports finding it also in baby food. The congressional analysis finding it in sweet potatoes. And what we think is that improper battery recycling, where they release a lot of the battery dust because they're only done in backyards, the dust that goes into the air falls into market gardens nearby. And then the products that are grown there end up in the global food supply chain and poison portions of it. So that transboundary issue is a major concern in all of this. Moving a little bit more into the chemicals agenda, we also must remember it's not just premature death that we have to worry about with the chemicals agenda especially. Major concern that I see out there is that a lot of these toxins damage the brain, and in a permanent way. We know, for example, lead will, at the levels that we're seeing 1/3 of the children, it will mean a loss of intelligence, 3 to 5 IQ points. There's also correlations that show that that means there's more societal violence out there because of the damage that occurs to the frontal cortex. And we know also that that means lower educational attainments, about a year of education lost. So you think about it, 1/3 of the world, in many countries, 1/2 of the population has lost all this IQ. Means their ability at a population level, not at an individual level, but at a population, their ability to be able to evaluate truth from false, to make good decisions, has been fundamentally reduced. So what does that mean for people, vaccination rates, for example, for all of the social media questions that are coming in, even for perhaps for how people vote. It's really a fundamental problem, this issue of neurotoxicity in chemicals. We also, of course, worry about reproductive toxicity, especially for endocrine disruptors. And this reduces fertility. It brings with it itself an enormous range of issues. So one of the key recommendations, and we'll talk a little bit more about this, is that there's an intent to do for chemicals and pollution what happened for climate change. Create an international panel of experts who can advise policy. It's the IPCC in climate change, and the recommendation is for a science policy platform similar for chemicals and pollution. So where do we go from all of this? This is kind of disturbing to see some of these impacts that are out there. And what we think needs to happen is we need to actually make especially modern pollution a priority in our development agendas. And this means countries that are affected need to integrate these issues, chemicals, lead, and air pollution, ambient air, into their development strategies. And it needs to be part also of how donors look at supporting energy and activities, especially in low and middle income countries. And there's a few very useful things that we can do to help governments in low and middle income countries. One is to help them to understand the size of the problem that they're having. And this is done through health and pollution action planning. And Rachel will talk a little bit more about that, right? Another thing that we ought to do is, these are silent killers that are occurring. We need to monitor them and make it publicly available. So we need to have air monitors in cities put up. A little bit of that public available information really switches on public opinion and moves politicians into action. We also need to monitor for lead. Most countries in the world outside of the wealthy countries do not measure at all lead levels, and that needs to change. There should be other biomonitoring systems coming up and inexpensive ways to measure other kinds of chemical burdens as well. So last in our recommendations is we need to understand better this issue of transboundary exposures, because we're not actually able to stop global food chains from moving. We can't stop and monitor it any more than we are right now, because it halts things and it means foods will go off. Instead, we need to understand where the exposures are coming from, because it's not all food, it's only the little pockets of food that become toxified. You know, understand where they're coming from and then provide the right services and support to stop those exposures from happening, and therefore help the entire world to deal with all of this. So 5 years passed, we've had a pandemic, we've had a lot of other dramas go on, but we didn't get much done on this enormous issue. I would like to see in 5 years that we don't end up with the same result. I would like instead to see that there are programs out there within the governments that are affected, within the international philanthropic community, to actually deal with this issue and make it happen, and see it be a part of the development agendas in the ministries of health, environment, alongside all of the other things we worry about. Plastics in the ocean has been added. This is a much larger problem than plastics in the ocean. We should certainly be able to add this on as well. And we should end up with a focus globally that there are 3 crises occurring in the world: climate change, loss of biodiversity, and pollution. That's the way that UN Environment considers it. That's the way we ought to be considering it broadly. And if we can do that and put some focus to pollution, we'll make the world healthier, we'll make it safer, and we'll make it more productive. And that is a goal worthy. Thank you for your time, and I'm looking forward to any of your questions. And Jack, do I pass this back to you, or?
Yeah, I think we're gonna have Rachel.
So I'll pass back to Rachel, and thank you kindly. You ready?
All right. So I hope you're not all too depressed. That's a lot of data being thrown at you and a lot of years of research, really showing the burden of disease and all of its impacts and societal implications and all of that. So the big question now is, what do we do about it, right? We have a lot of recommendations that Richard discussed, and I'm pleased to go through a couple of them a little bit more in detail here today. So we can look at how can we reverse the issue of modern pollution, especially, right? So we know a lot of investment went into traditional pollution, and that's been having results. So we need essentially the same types of things. So we can learn from the lessons of having put climate change on the agenda, putting biodiversity loss on the agenda, and putting dealing with traditional pollution on the agenda. And how do we do that? Well, we have to prioritize, we have to allocate resources, we have to establish this science policy panel that Richard was talking about. We need to partner. There are so many opportunities to partner to get this work done. And then, of course, implement, prevent, control, and mitigate. So I'll go into a couple of those in a bit more detail. So Rich was talking a little bit about what governments can do. And of course, prevention is the key thing. This means, for the Global Alliance on Health and Pollution, this means keeping people out of hospitals, right? Reducing hospitalization rates. This means preventing children from getting sick and keeping them in school. This means tackling pollution at the source. So how do we start? What do we do? So the things that the Global Alliance on Health and Pollution has been starting to do, and this is our 10th year anniversary, by the way. This is a big time to have this report out. So we need to really continue to draw attention at high-level political forums and events such as G20, G7. We need to be looking at other ways to tell this story. So where else does this pollution story fit in? Well, it does have overlaps with climate change. It does have overlaps with biodiversity loss. It's been identified as one of the 5 risk factors for biodiversity loss. We need to draw links to other areas such as educational attainment. So Rich is talking about the impact of lead on children's ability to learn. It's taking a year off of their educational attainment. And we need to be measuring better in the Sustainable Development Goals. So right now, the indicators that are in there are totally insufficient to account for this large burden, especially from the chemical side of things. Okay, so this is the international, let's prioritize, let's get some action going on this, let's draw attention. Well, what can countries do? Because often they have competing priorities, right? They have to build infrastructure, they have to get their economies going. There's a lot of things drawing on the attention of ministries of finance, and pollution is not one of them yet. So how do we change that? The Health and Pollution Action Planning process that GAP has been working on is a way to bring together ministries of health and environment, but also try to get other ministries involved, get industry involved, transport, agriculture, anyone who's got purview over pollution. We also should be bringing in the education department, finance, and help them break down those silos. And this is not something that any country does particularly well, right? We need to get them talking and seeing these interlinkages. We need to be helping them come up with the convincing arguments. What does their Ministry of Finance actually need to hear? Do they need to hear that this is the cost of inaction, or that they're going to have a result in 2 years, right? If you're looking at, I've only got $1 million to spend, what am I going to spend it on? How can I show my population some results? Well, pollution is a great place to do it. We saw during COVID times when the shutdown happened that if you literally stopped action, we would have cleaner air. Now, nobody wanted that to happen for the economic consequences, but it showed that if you take decisions and implement them, you can have immediate results, okay? And then we need to be incorporating all of this into development plans. So, if we think about how national budgets work, the government has to allocate funds to things that they want to prioritize, that they want to care about. If you're a poor country like Madagascar or other countries that don't have a lot of resources, they have very small budgets for their Ministry of Environment or Health. Okay, this is something that we can help say, if you have resources, let's figure out how to make it happen. But if not, here's what you need to do. Let's go talk to your development agencies. Let's talk to the World Bank, UN Development Program, other partners that have different suites of technical resources, financial resources such as loans and grants, and get this action in motion. Okay, allocating resources. We're talking a little bit about this, but what does that really mean? So today, when we look at what's happened from 5 years ago until now, almost no bilateral aid agencies have actual programmatic lines where they have staff whose job it is to help other countries deal with pollution. This needs to change on a big scale if we actually want to address pollution globally. So our recommendation where we would like to see this agenda in 5 years is every bilateral aid program has pollution somewhere. There's somebody responsible for that program. And also there's a role for everyone, not just bilateral aid agencies, but multilateral development banks, philanthropies. We've had a couple philanthropies start to think about pollution. It is not on their radar, and they are a huge resource for being able to address development problems globally. The private sector as well. We've had some engagement. We'll be talking about one of those in a little bit later in the presentation. But they have enormous, not only financial resources, but the technical resources. These people in the private sector have a lot of expertise and lessons and things that they can share and dialogue that they can have with other private sector companies and low and middle income countries. And then we talked about the national one already, right? Getting it into national budgets and requesting aid. Okay, in terms of partnering, so there are a lot of different things that we can think about doing. We can look at how we can partner with different ministries, different agencies in the corporate sector. So the big example here is the Protecting Every Child's Potential. This is a model for how we can successfully engage with the corporate sector on lead in particular, and we'll hear a lot more about that afterward. We have at the Global Alliance on Health and Pollution, we've started a global lead forum. This is a platform for anyone who's interested to talk about what lead pollution does. What is the newest research? What are people doing? What are strategies? What's worked? What hasn't worked, right? This type of dialogue at a global level and even in different languages, right? So that this information is accessible and out there so that people understand. That's a really critical thing. Rich also gave a plug for joining the Global Alliance on Health and Pollution. We are one of the groups that has our pulse on what's happening globally on this. And then implement. Okay, so this is not a surprise. We've been talking about implementing. What we're really looking at here is the ability to catalyze change and to actually reduce the impact of pollution on people's daily lives. Okay, so there are a lot of recommendations in here. The Health and Pollution Action Planning process is one. So just to give you an example, we've been working with Madagascar. They were the first government to implement or to adopt a Health and Pollution Action Plan, and it's catalyzed action. They created an interagency task force on pollution. This is one of the poorest countries in the world. They don't have a lot of resources. This is a country where more than 90% of people are cooking in their home with wood and charcoal and dung, right? That's incredible here for us to kind of think about what that daily impact is like. So they're looking at taking this process and saying, okay, how do we build a 10-year roadmap to tackle pollution? They announced that last fall, and they've asked our alliance for help in making this happen. What are some other things? Well, when we look at pollution as a movement or how environmental movements get going, we don't actually have a pollution movement of local civil society grassroots organizations that are super jazzed up about this topic and shaking the trees and shouting from the rooftops and holding their government officials to account, right? That's a critical piece of this. We need to be creating that demand. And then, of course, as Rich was talking about, we need to understand what we're actually dealing with. So most countries don't have blood lead level baseline information. They don't actually know how severe it is in their country. They're relying on external data sources, and they don't have a clear impact of how these things impact a low resource setting where you have outdoor air pollution, indoor air pollution, lead exposures, all of these things combined. And then, of course, we want to be looking at what projects we do and how they can actually show those results, right? That's what gets people excited when you start saying, okay, I've got this community that's had reduced blood lead levels, or this kind of was phased out, or these agricultural workers are no longer applying pesticides in a way that harms the environment and their health. Thank you. So we also have a video. I'm going to see if this plays, and then after that, we will go over to addressing questions, and hopefully someone's been monitoring the chat. All right, let's see if I can make this work. Okay.
You've probably heard that pollution is bad for the environment. But did you know that pollution is indeed the world's largest environmental risk factor for disease and premature death? Since at least 2015, pollution has killed 9 million people each year. This is more people than war, hunger, malaria, COVID-19, AIDS, or tuberculosis during that time. And yet, we think of pollution as an environmental issue rather than as a health issue. Pollution has not been on the public radar because of a lack of understanding of how big this problem is and how many people are impacted. The Global Alliance on Health and Pollution, a network of over 65 international and national level agencies based in Geneva, Switzerland, is working to change this. In 2022, a new report published in the Lancet Planetary Health highlights the changing nature of pollution. While deaths from pollution linked to poverty, such as household air pollution and inadequate sanitation, have declined over the past 20 years thanks to significant investment, deaths caused by pollution associated with urbanization and industrialization, ambient air pollution and toxic chemical pollution, have increased substantially by over 66% over the past 2 decades. These rises are driven by fossil fuel combustion, industrialization, uncontrolled urbanization, population growth, and lack of national or international chemical policy. Over 90% of these pollution-related deaths are in low and middle-income countries. Many countries do not have the resources to address this serious public health problem. The time to act is now. Pollution prevention must become a priority in the International Development Agenda. One key way forward is GAP's Health and Pollution Action Plan, HPAP. The HPAP is designed to assist governments of low and middle income countries to develop and implement solutions to pollution-related health challenges. For more information about how to be involved, visit gahp.net.
No, we're not stopping share.
So you're going to Q&A now?
Yeah.
You could stop sharing, they could just see them.
No, go to,
Yeah, you want to go there? Next slide.
yeah.
She said escape.
You've
Oh, okay.
You're at the very beginning?
No, we're at Q&A.
Okay, everybody, we have many questions in the Q&A. We'll spend a couple of minutes on this. We can't get to them all, but of course, you know where we live and you know how to track us down. So let's begin with some of these in no particular order. Well, here's an interesting one. Do you have any geographic mapping of exposure and mortality? And this is a good one. I think I'll take this one if it's okay, since I have the podium. And the answer is yes. And what you have not seen in this report, which hopefully you've downloaded and read some of it, is that we have tremendous amounts of country-specific data by pollution source, by disease, by year, by age, IHME, together with GAP and Pure Earth, have assembled a plethora of data. And the good news is you'll be seeing this trickle out over the next few months. So we're really excited about this. So this is just the beginning, but we have data on just about every single country. If you have specific interest in some data for a country, I recommend you contact Pure Earth, myself, or one of us here, and we could probably get you that data and something of a chat on it. So that's good news. For Richard, you mentioned monitoring newborn and pregnant mothers. How about monitoring preconception of males and females, especially adolescents? So this gets around the issue of biomonitoring and how we can improve that. Richard, you want to put on your
the monitoring issue? If you look at it in the West for lead, currently relies on newborns and then people going into school, and that's used as a time when we're checking for lead levels. That in most of the countries that are badly affected by lead, there is no monitoring whatsoever, and there is an excellent call, I think, for lead monitoring to occur broadly through these countries and understand where the exposures are happening the most. So if it happens to be, for example, young men who are getting most of the exposure for lead, yes, that's going to have an implication in all kinds of aspects of their future lives. And we have to remember that when we're monitoring and worrying about lead exposure, the neurotoxical damage is one that occurs in children, but the almost 1 million deaths is cardiovascular disease, and that happens to anyone who's exposed at any age. So if you get a dose of this stuff and you're 55, you're going to have much higher risk of having heart disease. So I'm fully behind any monitoring anywhere that can happen throughout the population. Yep.
Yeah. Absolutely. And I know that's a personal goal of myself, to really see more and more lead surveillance programs in some of these countries, or at least maybe one-time large lead screenings of a population, which is severely lacking. In the US, we're rather advanced in that area, but we definitely need more work there. I think I have one here for Rachel. Thank you, Prakash. Developmental strategies. Your question is, this is one of the recommendations, integrate pollution with developmental strategies. Can you elaborate upon this a little bit more? Integrating pollution with developmental strategies.
Sure. Okay. So thanks for that question. There are a variety of different types of development strategies. We actually have UNDP here today, who also knows very well that UNDP has country strategies. So what we did in this report was look and see which of the existing World Bank, UNDP, and other development strategies that are out there for each country actually talk about pollution, and very few of them do. So this is one thing that we can change. How do you get that actually in there? Well, each of these country development strategies for external assistance have their own cycles, programmatic cycles, 2 to 4 years, sometimes 5 years. So we want to know, when we're working with a particular country, if they're doing a health and pollution action plan, when are these cycles up? When are people talking about things? And who is the ultimate decision maker? So what's that power map look like of decisions? Again, going back to those points that I was making about how do we convince the Ministry of Finance, who's the one who's making these decisions at the national level, what are they concerned with? How do we raise it to their attention, right? So that's something that we look at through that health and pollution action planning process. The other way, of course, is through a government's own national development plans or strategic plans that they might have. China had, for example, a war on pollution declared. They had a 5-year plan for what they were going to do. Similarly, we're looking at, with Madagascar, developing a 10-year roadmap, right? It's something that the government will actually adopt and mainstream. In Central Kalimantan, Indonesia, they are incorporating the health and pollution action plan into their regional development strategy and looking at, okay, well, how do we implement this on a district by district level? And then we can take those lessons and kind of say, okay, well, let's apply it to the next region over, or let's apply it at a national level. So those are the types of ways we can mainstream that. Thanks.
Good. Okay, Rich, I think this one's for you. Is there a type of pollution that you wish would be included in future reports?
Mercury. Yeah, so the chemicals agenda is the piece that's missing. If we could first properly measure lead exposure. Some scientists think it's twice as large or 3 times as large as it is right now. That's one thing. But we ought to also be measuring mercury exposure, which is a huge issue, and actually, because there's a convention around it, has the potential of channeling a good resources through a convention mechanism to deal with it. There's some of that going on right now because most of the exposures for mercury are with artisanal gold mining, as you may know. I would like to see also that we're looking at asbestos. The asbestos numbers are likely in the hundreds of thousands, not the millions like lead, but still enormous. And I think we ought to look at cadmium and chromium, the rest of the heavy metals, and look at their burdens as well. So because the exposures for these are unknown, doing the right kind of smart technical work to work out what they are and what the burden of disease are really help us to understand the extent of the chemicals agenda nicely.
Yeah.
Yep.
Yeah, if I could elaborate on that, IHME has very high standards for producing these mortality, morbidity reports. So you would ask yourself, can they predict how much mortality from climate change, from plastics pollution? And it's an intriguing question. Maybe one day we'll have the metrics, but right now we just don't have marker diseases for some of that. But I'm happy to say IHME is committed to really moving in this direction, and we're so happy to be working with them. I just, a great bunch of professionals there. Let's see, I have, there was a question on mortality versus morbidity. And does this report include morbidity, meaning illness from these hazards and not necessarily fatal deaths?
So we certainly do have morbidity statistics in all of this. When we looked at the messaging potential, DALIs are less easy for the New York Times or the CNN reporters to be able to understand. So we focused the report around premature death. But the DALI numbers are there and show exactly the same kind of response that we would expect, and are very similar to the way they were in the first report. Yeah. If you want them, call us.
Yeah, we'll be producing more and more reports. It may not be published in the Lancet, but absolutely, there's very, very important numbers. How are we doing with time?
We're good.
We're good?
5 minutes?
All right, I have a question here. How has COVID shifted the pollution agenda, and can we recover? That's a tough one.
Yeah, so, I mean, when you look at global trends, when the report came out, there was some movement. UN Environment adopted pollution as one of its 3 global crises. There's some energy with WHO that was working well. And then, boom, COVID hit. And all of the world ended up, needing necessarily to focus on the pandemic. So we look at these large problems as drawing energy from a nascent area that's growing. Climate change also, too, has taken a lot of the environmental focus, the majority of the environment focus, and for good reason. The thing, though, is we can multitask. It's completely within our capacity to multitask. And the proof of that is we've been able to pick up plastics in the ocean. So bravo, that's a great thing to do. Let's multitask again. And while we have all of the other issues going on, add this one in appropriately into our development programming.
Okay. We have the questions are coming in fast and furiously, but we're running out of time, so we will sort these out and get them to you shortly. What question did?
No, we could do one more, but we can move on and people can.
Well, there's an interesting one here, I think directed at me, saying, Jack, what's with Taylor Swift? So let me explain that comment. While I did receive a teaching award for the School of Global Public Health, and I'm honored. Thank you, everybody. At graduation yesterday, Taylor Swift was our commencement speaker. You can catch it online. And she did wave at me. I was one of 10,000 people she waved at, but I think she looked my way. So that's what that was all about. But it was an amazing day there. Okay, so now let's move to our next segment called the Call for Action. We will hear from three people, Dr. Howard Hugh, Ana Margarita Garza, and Glo Yanada. While my team is getting ready for this, let me introduce these speakers. Okay. All right, let's start with Howard. Howard will give us a response to the report and opportunities it presents for scientific research. So again, we have three realms here: science, corporate, and the community sector. Howard is a physician, scientist, epidemiologist, jack of all trades, as I say, and has been a tenured professor, director, department chair, dean in several universities, including Harvard, University of Michigan, and University of Toronto. He's currently in California, professor and the Flora L. Thornton Chair of the Department of Population and Public Health Sciences in the Keck School of Medicine at the University of Southern California. He's led international teams investigating environmental, nutritional, social, genetic, epigenetic determinants of disease, chronic and acute, and in a variety of populations, children, etc. Many of his studies are based in Mexico, India, and China. He works with us a great deal. I love working with him. And most recently, he co-initiated and continues to lead the Global Burden of Disease, Population, Climate, and Health Initiative, and is currently leading several COVID-19 cohort studies based in the LA area. Howard, it's great to see you, wherever you are there. It's great to see you, have you back. There are many of these questions that were directed at Howard and some of the other staff. So we'll get these Q&A questions to the right people and get your individual responses that way. Okay, Howard.
Great.
Thanks,
yours. Jack. I hope everybody can hear me fine. I'm really pleased to have been part of the commission and also have been pleased to be involved in the Global Burden of Disease project, which has been administered by the Institute for Health Policy, for the Institute for Health Metrics and Evaluation in Seattle for the last 15 years, working on the lead piece, but also working on this new initiative to expand the purview of the global burden of disease to understand the footprint of these other chemicals, just as Richard and Jack have been talking about, whether it's mercury, arsenic, pesticides, other organic pollutants. It's really refreshing that attention is finally being paid to pollution. This is an insidious and invisible killer, but it's not only just a killer, but it's a stealthy enemy of the normal development, the very thing that makes us a unique species on Earth, our intelligence, our ability to socially interact. It's for this reason that among the spectrum of pollutants, the Lancet Commission has continued to focus so much on lead because of the evidence of its impact, something that I've been studying for 30 years, on children's IQ and mortality from cardiovascular disease is inescapable. It's also the reason why one of the lessons of the Commission's work is the importance of understanding the extent of the problem, particularly in countries where there's very sparse data. One of the examples that has been underscored is the initiative by Mexico to incorporate blood lead testing in the national survey they conduct called ENSANUT, which is a survey of nutrition around the entire country. It's an example of what could also be done in other countries. Its role in identifying lead glazed pottery as the current major source of lead exposure is invaluable and directly points the way to intervention strategies that need to be taken. This strategy can be taken in other countries using some of the relatively simple and inexpensive strategies that have been developed for field testing, and by partnering with the growing community of scientists who are expert in understanding how to apply these tools and how to interpret the data. That's why I'm also very pleased to have been a 30-year member of the International Society for Environmental Epidemiology, which now has chapters all over in Africa, In Asia, we're developing this network of environmental epidemiologists who can partner with the policymakers and government scientists to use these kinds of tools to understand what is the pollution impact and footprint in their own home countries and the regional basis of these, and what are the sources of pollution. It's also why, going back to the Commission and the global burden of disease, we need more investment in understanding other neurotoxicants. As mentioned by Richard, by Jack, by Rachel, by others, there are other pollutants that we now understand affect IQ, impact behavior, things not only like mercury, but some of the persistent organic pollutants that we created, with our industries, like bisphenol A, the chemical that's been used in food cans to make it easy for food to come out of cans. Phthalates that were used in plastics and plasticizers to make plastics more flexible. PFAS, perfluorinated compounds that were used to make the nonstick surfaces on those frying pans we've used all over the years. And turns out now we have the insight that these are other chemicals that affect intelligence, that are affecting the synaptic networks that make our brains connect when we grow as children. And this also actually dovetails as one of the questions that came up in the chat, which is, how do we try to screen or understand these chemicals beforehand and also tag the industries that are involved in producing them? So we need to also work with our policymakers to enforce and strengthen those regulations that call for pre-market testing and the distribution of some of these products around the world, while we're at the same time taking a close look of what their impact might be in the real world. With better tools and studies, the scientific evidence now reveals what their impact truly can be, but we don't understand their exposure profiles, particularly in low and middle income countries where we need to do this kind of profiling. It's not easy to do this kind of profiling. As Richard said, we have to be able to monitor them in blood or urine, because doing simple soil monitoring or air monitoring does not get at the major sources of exposure for these chemicals. But again, this is possible with the new technologies and the new community of scientists who are collaborating between countries and between academic institutions like the institution Jack is at, the new global public health institution at the New York University, and our medical school and other schools of public health around the world. These are key investments that allow us to secure the intellectual and physical capital of societies going into the future, mindful how so many low and middle income countries are trying to leapfrog into the knowledge economy in order to invest in those industries that are so powerful and important to our society's future. How can you actually invest in these knowledge economies if you're having these pollutants impacting on the IQs and behaviors of our children growing up? I also note, to conclude, that there's no doubt that we also have the ability, and we're moving towards having the academic community understand the integration of these pollution issues with other major global health threats to society. We're not just looking them in silos. We're looking hard at how to understand how to grapple with these issues at the same time we're grappling with climate change, with COVID-19. I'll just give you an example. One of the air pollution and climate change linked problems that we understand is that when we're dealing with this on a ground truth level, on the building level, on a home level, we understand that when there's wildfires, climate change driven wildfires, there's PM 2.5, smoke that's up in the air that we need to try to protect ourselves from, because now we understand that air pollution impacts not only mortality, but also is one of the pollutant drivers of intellectual capacity and neurologic growth. But at the same time, with the COVID epidemic, We understand we need to increase our fresh air intake to reduce the ability of the COVID-19 virus to circulate in our air environments. So we need to balance somehow this need to increase air intake in our buildings, but also decrease the air intake of polluted air. We can do this. There are technologies, there are approaches, and we can approach these in an integrated fashion, but that's only if we pay attention to the integrated agenda of global population and public health. We can do this with our policymakers, with our scientists, and particularly as we try to understand the footprint of these impacts on society. So the main message today is that we are here to work with our colleagues in fantastic NGOs like GAP, yourselves, politicians, policymakers, the academic community. We can get at this together. We can do the life cycle analysis. We can do the analysis that will enable us to leapfrog the mistakes of our polluting high-income countries to get at the development agenda of our low and middle income countries and do it together. Thank you.
Thank you very much, Howard. That was wonderful. I especially thank you for linking that COVID engineering air filtration issue. COVID, while painful, devastating, has taught us so much, including how to Zoom. But in the indoor air quality world, it has taught buildings that they can achieve high quality air cost effectively. And you're seeing more and more of it now, whether it's an airplane or bus or taxis. We're seeing the whole renewed emphasis on filtration. So that is good news on that. Next, I'm pleased to introduce Ana Margarita Garza. Ana is a Director of Public Affairs, Latin America of Clarios, and board member and treasurer of the Clarios Foundation. The Clarios Foundation is a founding member, along with UNICEF and Pure Earth, of the global-led initiative called Protecting Every Child's Potential. Clarios, for those that may know, is a battery manufacturer, the organization. It's the largest battery manufacturer and recycler of lead-acid batteries in the world, and is particularly committed to solving the global lead exposure crisis. Ana will speak about the role of industry and corporations in playing a role in this crisis and helping to solve it. Ana, how are we doing?
Yes, thank you. Can you hear me okay?
Yes, we can.
Thank you. Good morning, everyone, from hot Mexico. I am very pleased to be a part of this event, and I think a lot of what has been said needs action. And one of the things that for me was most impactful and more important about this problem of pollution is that there, specifically on the lead side, there is ways to solve it and to prevent it. And so industry, corporations, organizations can be a part of it. And here we need to be very creative. And so pollution does not discriminate. It affects all, but typically the vulnerable are the ones that are the most impacted and the hardest. So I think industry can lead change in the communities they operate. They can prevent pollution, and that helps not only the planet and the people, but also business. In the case of Mexico, and I can tell you, one of the programs that Protecting Every Child's Potential has is in Mexico. And the main source, as it was said already, the main source of lead in blood is, or poisoning is due to traditional pottery, which is glazed with some lead. and that leaches into food and drinks. So it might not be that you're the potter, but you're a consumer of Mexican cuisine. And if it's served in this type of plates, then very possibly you are consuming some amount of lead. And for children, this is particularly of concern because of all the reasons that have already been mentioned. So everyone's participation is really important, and joining forces and bringing scale is of the essence. Collaboration is key. And so every partner brings knowledge, technical expertise, scale, and all of us are focused in mobilizing others. You can see photos and examples of how the rest, can you go to the previous slide, please? There you have a Master Chef Mexico, there's a cookbook, there's pottery fairs, that there's lead testing. And now can you go to the next one, please? You'll see technical and workshops and technical assistance and helping potters get and do the transition. And you will be amazed the type of companies that thought that they had nothing to do with this, but there's an insulation company which might be helping with the kilns. There's a financial company that can help them establish a micro credits and micro loans for the potters to restart their business, especially after the pandemic. And so there are many ways in which companies or organizations can be a part of this. Restaurants, chefs, industrial or business organizations in Mexico. We are, Pure Earth is establishing an agreement with the American Society of Mexico, which encompasses U.S. Businesses that are established in Mexico. We're talking big companies. And the reason for this agreement is precisely to mobilize and have many companies understand that pollution, and in this case in traditional pottery, but pollution is something that needs to be a part of their agendas. A lot of companies are moving into this type of arena, the ESG activities, and making it a part of it. I think we need to be more aggressive in the communication in having all this information made available and inviting others to join forces. Why? Because there are ways to prevent and solve. And here you have a list of, as an example, of things that have been done in the past 2-3 years, even with the pandemic, that with creativity and with the will to change and solve an issue, we can do much more. And I think it's not only about the car industry or the lead acid batteries. It's about many sectors that can collaborate not only on the lead pollution, but there's mercury, there's air pollution, which is also a big one in cities like the city Ambient in Monterrey, in Mexico, which is a very industrial, and there's a lot of car park, and that doesn't, and the surrounding areas in the mountains do not help with the air quality. But companies are mobilizing, and I think it's about time to join forces and to move into a more active role. And so my conclusion is that it is possible, and collaboration is key. And I think it is important. And I mean, we are very, very grateful to be a part of this initiative. I am, and I am really involved and willing to bring others to work and join forces. So thank you so much.
Thank you, Ana Margarita. I appreciate it. It is interesting how lead acid batteries, which are so recyclable, the plastic, the acid, the plates, the oxide, it's a wonderful, it's 99% recycled essentially, is a wonderful commodity. We need more commodities that are so highly recyclable, but for the same reason, it of course is done in that informal manner, which is causing so much damage. So I'm very hopeful that we'll eventually together fix this problem. Lastly, and it's in our office right now, in our room right now, I'd like to introduce Gloria Janata. Glo, as she's called, is the owner, president, and CEO of Togo Run, a woman-owned global healthcare communications agency. She provides hands-on communications and public policy counsel to leading change makers who are seeking to make a healthy impact on the world via innovative health and environmental solutions. She's well known to us. She's been working with us for years. Gloria and Togo Run have worked on the communications program for the 2017 Lancet report, which reached 2 billion people out there. And she's working with us on this release, which is up to 2,500 media outlets have picked this up already, including Washington Post, Guardian, ABC, NBC, Bloomberg, on and on and on. Glo will talk about the potential of communications and advocacy efforts to build political will and public demand for pollution solutions. Glo, it's great to have you here.
Thank you so much, Jack.
All yours.
Thank you very much. Everybody, thank you so much. Put my water right here. I'm honored to be here. Thank you so much, Jack, for hosting, and honored to be working with this incredible group of leaders to make a real change. As Jackie mentioned, the Lancet 2017 Commission report was groundbreaking. For the first time, the world realized the true toll of disease-causing pollution, over 9 million premature deaths, which is absolutely unthinkable, unacceptable, yet it is a reality. The global media, as you said, took notice. If we can maybe put the slide up there. Oh, I'm doing it? Oh, yes. So sorry. The global media took notice, and the issue received over 2 billion media impressions. And this new awareness did translate into some important global actions following the report. We were very happy to see that the UN Environment designated pollution as a theme of the 3rd UN Environmental Assembly, which is, again, we've got to get the word out. We have to get everybody focused on it. And the World Bank acknowledged the need to address pollution's impact on GDP and health. So critically important there. However, disease-causing pollution, which again is a term that I really would love everybody to start using, as everybody here at Pure Earth knows, in a gap, because just talking about pollution sort of generally does not get to the point of what we really are talking about, the real impact that it has on so many of us, and especially our children, and the brains and the bodies of our children. So it's really not getting the attention it deserves. We know that pollution knows no borders. It's not just a cliche, it's absolutely true. And it's getting in our baby food, our spices, seafood, air, water, and soil. And, you know, it's been around for a long time that we've been talking about this issue. Franklin Delano Roosevelt said the nation that destroys its soil destroys itself. I think that we all need to take that to heart again and really be thinking about what we need to do to make a change. We need to promote the pragmatic solutions and policies that exist and shine a light on why they're not being implemented. For example, here in the US, media and NGOs need to investigate the reports on the food supply chain, the global food supply chain. We need to get to the bottom of that, start at the source, and really look at the solutions that need to be made. This is possible. We've seen it. I think it was Howard that mentioned again, and Rich that mentioned, you know, just how do we really mainstream a message? The images of the sea turtles with the plastic around their necks and with they've been doing to, you know, this kind of, you know, something that can relate to, that everyone can relate to, is very important. We've also seen Little Miss Flint, who just received this weekend the Billboard Music Award for the 2022 Changemaker. And she, of course, has been raising awareness about what's been going on in Flint as she says, for her whole life. She's 14 years old. She's making an impact. How do we continue to try to give a platform for these incredible people who are really trying to make a difference? Over the past 5 years, we've also seen a lot of incredible gains in severely impacted countries. And Anna Margarita, hi Anna, wish you were here. You know, over the last 5 years, we've seen some incredible things happening in Mexico. In 2018, a national blood level survey, lead level survey, confirmed the toll of lead on over 1 million children, and Anna Margarita was speaking about this. The issue touches almost every household through leaded pottery, as we discussed. This data in the context of the Lancet data was shared with various stakeholders, the government, corporate sector, and was amplified by the media. The government's National Health Council designated lead poisoning as a top priority, which is what we want to see governments do. There's a steady drumbeat from the Mexican media who are reporting on efforts to remove lead from traditional pottery. And Pure Earth Mexico, who has appeared on MasterChef Mexico, Azteca Noticias, one of Mexico's largest broadcast news programs, and dozens of other articles in the Mexican editions of Bon Appetit, Food and Wine. And thanks to the collaboration between Pure Earth's Mexico team and Mexican media, we are gaining real traction in lead poisoning prevention in the country, and it's becoming a part of the national dialogue. And in Bangladesh, which is on the other side of the slide there, that is one of the most lead-impacted countries in the world, as we know, is experiencing a similar momentum in growing awareness and interest. And government officials and partners, including the media, are eager to address the problem and have been collaborating with Pure Earth and UNICEF on these solutions. There have been over 24 stories on the lead poisoning crisis in Bengali media in the last year, with regular op-eds in the Daily Star, which is the largest English language paper, the Daily there, and the Financial Express. And for the first time, Prothmo Allo, one of the country's largest media outlets, hosted a roundtable during International Lead Poisoning Prevention Week, which was attended by high-level health and environmental and civil society and industrial stakeholders. So we need to replicate this everywhere. Everyone has a responsibility, from media to the government, to help get the word out, because everyone is affected. And, you know, not to end on a sort of a depressing note, but humans are the only animal that destroy their own nest. It's ridiculous. I mean, my God, we have to change that. We've got to do this together. We have to have, you know, find ways. Again, these pragmatic solutions are there. You just have to implement them. So that's it for me, and thank you very much.
Well, thank you very much for that. I just want to say that myself and Professor Bill Rahm, who's in the room, who teaches our climate and public health course, have been teaching about health hazards and recognition, and over the students tell us the number one health problem, public health, environmental problem is climate change. And while we agree it's very serious, needs action right away, 9 million people, we heard from Rich, are dying every year from essentially preventable conditions. And when you look at the last 5 years of the Lancet report, it's 50 million people that have died. COVID killed, 1 million in the US. So it is really a communications issue. And sometimes I want to grab my students and say, you know, there's other causes of death. Climate is a long way off. We got to get on the road to fix it and prevent more damage. But there are diseases right now that need attention.
Well, can I make a comment on that?
Yes.
So when the look at climate and deaths is put forward, in fact, the vast majority of those deaths are air pollution. So climate numbers and deaths and projections, most of it is from the air pollution numbers themselves. There's a little bit from heat stress, but in fact, on the other side of the equation, there is a reduction in the number of deaths from cold stress that actually is larger than the heat stress side of things. So when it boils down to it, the climate numbers are relying on ambient air pollution to show large death numbers. So just pointing that out. pollution might be the best way through to look at this issue.
Good. Thank you, everybody. So that concludes our program. I'd like to thank all the speakers for the session, for the wonderful session. We have many questions that are coming in. I want you to know that I'll probably be spending the rest of the day answering these online. But we'll get them out to the right professionals and get you responses, I promise. We will be sending all participants a follow-up email. And if you have any additional questions, ideas, comments, we're all ears. Please share them with us. You know where to find us online. Lastly, the recording, of course, will be distributed to you as soon as we clean it up and get it ready for you. Also, I want to just say that be on the lookout for podcasts, whether it's from Pure Earth or GAP or NYU. This is our life. We've been with it for many years, and we will continue to get the message out and look for that country-specific data that will be coming out shortly. With that, I want to thank you all for your attendance and your participation, and just have a wonderful day. Thank you. Thank you, Anna. Thank you, Howard.
Thank you, everybody.
Thank you.
Gloria. Glo.
Have a wonderful day.
You too.